Perioperative rosuvastatin in cardiac surgery. My name is Oscar Alexander Sevilla Solis. I am 24 years old. I am going to talking about the rosuvastatin. Rosuvastatin is in a class of medication called statins. It works by slowing the production of cholesterol in the body to decrease the amount of cholesterol that maybe will act on the walls of the arteries and block blood flow to the heart, brain, or the other parts of the body.
This video discusses two types of lipoproteins that carry cholesterol: low-density lipoprotein, or LDL cholesterol, also known as bad cholesterol, and high-density lipoprotein, or HDL cholesterol, also known as good cholesterol. LDL travels through your bloodstream, delivering cholesterol to the cells that need it. If your body has too much LDL, it can build up in the walls of your arteries. LDL and other substances in your artery wall form a fatty deposit called plaque. Over time, plaque can narrow the artery and reduce blood flow. LDL carries cholesterol into the plaque. This is why LDL is called the bad cholesterol. A common place this plaque can build up is in your coronary arteries, which are the blood vessels that feed your heart. This plaque buildup causes coronary artery disease and increases your risk of a heart attack. Plaque buildup in other arteries, such as the carotid arteries in your neck, can reduce blood flow to your brain and increase the risk of a stroke. Your liver also makes high-density lipoprotein, or HDL, also known as the good cholesterol. HDL helps remove excess cholesterol from your cells, tissues, and from plaque in your blood vessels. This is why HDL is called the good cholesterol.
Application in medicine. Accumulation of cholesterol and fat along the walls of the arteries decrease flow and therefore the oxygen supply to your heart, brain, and other parts of your body. Lowering your blood level of cholesterol and fat with rosuvastatin has been shown to prevent heart disease, angina, stroke, and heart attacks. Statins are associated with a reduced incidence of perioperative mortality after coronary artery bypass graft surgery. Application. The administration of statins to involuntary patients in the population is associated with a reduced incidence of adverse cardiovascular events, including death, myocardial infarction, stroke, and renal dysfunction. Additionally, the 1-year mortality rate after coronary artery bypass graft surgery in a small patient setting from a single institution was shown to be significantly lower in patients receiving preoperatory statin therapy compared with no statin treated patients. The analysis was performed on 943 undergone primary surgery at the Texas Heart Institute, controlling for patient demographics, medical history, and preoperative medication. The patients were classified in two groups. Patients received preoperatory statin therapy 720, and patients not receiving preoperatory antilipidemic therapy 1663.
Hello, Bailey here from the Pharmacist Network. This video is about Crestor. Crestor is made by the drug company AstraZeneca. The generic name is rosuvastatin. It is available in 5, 10, 20, and 40 milligram tablets. Crestor is in the family of drugs that we call statins. These are prescribed to lower the bad cholesterol in your body and slow down the buildup of plaque in your arteries. Arterial plaque buildup is associated with heart attack, strokes, and cardiovascular disease, so it is important to lower the levels of bad cholesterol in your body. Crestor lowers the bad cholesterol in two ways. It stops your liver from making VLDL, very low density lipoproteins, and helps your liver break down and destroy LDL, low density lipoproteins. Crestor is usually taken once daily, with or without food. We like to recommend taking Crestor at night. This is because most cholesterol is made while you're sleeping, but remember, it is most important to take the medication every day. Crestor does have a few drug interactions. Make certain to tell your doctor all the prescription and non-prescription medications you're currently taking. Also, if you start any new medications, double check for drug reactions with Crestor. Do not take Crestor if you are pregnant, may become pregnant, or if you are breastfeeding. Do not take Crestor if you have active liver disease, and discuss this with your doctor. Crestor is generally well tolerated. If you notice any unusual side effects, especially muscle pain, contact your doctor. If you have an accidental overdose of Crestor, seek immediate medical attention at the emergency room.
Result: I expect the incidence of story or epilepidemia was significant in patients receiving preoperatory statin therapy compared with patients not receiving anti-lipidemic therapy. The preoperative incidence of hypertension was also significantly greater in patients receiving preoperatory statin therapy compared with patients not receiving anti-lipidemic therapy unvariable. Advances: long-term statin administration in voluntary patient population has been prevalent associated with a reduced risk of adverse cardiovascular events including death, stroke, and renal dysfunction. Rosuvastatin might also be used to decrease the amount of cholesterol and other fatty substances in the blood in children and teenagers to 10 to 70 years of age who have familial heterozygous hypercholesterolemia. Disadvantage: the operative statin therapy was not shown to be independently associated with a reduced risk of operative cardiac arrhythmia, stroke, and renal dysfunction. Can cause constipation, stomach pain, difficulty swallowing, sleep or starting sleep. Can cause headache, memory loss, or forgetfulness and confusion.
um, by interfering with the synthesis or the production of cholesterol by the liver. And when they do that, they do it through a mechanism which interferes with the production of some essential proteins which we need. And because of that, they cause side effects. The major side effects include myalgias, which is defined as muscle soreness, muscle weakness, pains, sometimes joint pains. They cause headache, constipation, and other GI disorders, some of which can be quite serious. And according to the recently published Jupiter study, now they are known to cause mental confusion, type 2 diabetes, and the GI disorders actually are reported to cause even death. And we know from the previous experience the statins can cause muscle damage, which can lead to kidney failure, which can also be fatal.
Use applied in Ecuador. Doctors in our country have a drug to treat this lipidemia or high cholesterol. This is the creator developed in laboratories like an Ecuadorian pharmaceutical company with over 60 years of experience. Crestor is a pharmaceutical product of ours developed with the European in the Crestor National Laboratory. AstraZeneca was main areas of medical research and drug development are cardiovascular disease. Conclusion: preoperatory statin therapy might reduce the risk of early mortality after primary care surgery. As to the mechanism underlying this association remains unclear, further investigation on early statin treatment with cardiac surgical patient population is warranted. Thank you.